Tuesday, hosted by me, Ed Cara. I'm here to answer any questions regarding blood flow restriction training, and I will do so for the next 10 or 15 minutes. So if there's any questions, you can just jump up into that chat section and type in the question that you have. Hi, Lewis. Yeah, happy BFR Tuesday. I can't believe these weeks just go by so fast. All right. Any questions out there? Otherwise, I'm going to go to a patient that just came in. I shouldn't really call him a patient. It's more of a client. Came in and wanted some advice regarding using BFR with his training to help him with tennis. So I was just going to go over that with everybody today, kind of what we talked about. All right. So I think you guys can see this, hopefully. Looks like you can. So came in, he's been having some symptoms associated with like hip flexor tightness, hamstring tightness, medial and lateral epicondylitis. Plays tennis twice a week with a coach that does individual lessons. And then 2 to 4 times a week, he's just using a ball machine and hitting. So he's doing a lot of tennis. On top of that, he's doing something called Mandu training 2 to 3 times a week, which is resistance training with electric stimulation. It takes about 15-20 minutes to do a whole body workout. But what was happening is it was causing so much soreness that he couldn't continue to play tennis. So he backed off of the Mandu, and he wants to replace the Mandu training, strength training, with BFR. So this is what we talked about. I gave him the lowdown. That, to increase strength, going to take somewhere between 4 and 6 weeks with BFR at 2 to 3 times per week. To increase muscle size, we'll start to see increase in size at 3 weeks. Again, 2 to 3 times a week. And increasing aerobic capacity, it's going to start it takes about 2 weeks to start seeing an improvement, and you got to do it about 4 to 5 times per week. You want to train less than 5 exercises per session, BFR exercises. And I kind of broke down, that we do this 30, 15, 15, 15 per exercise. So when it's all said and done, we're trying to make the person more resilient for tennis, not necessarily make him a bigger, stronger human being, although that's going to be an outcome. And so what I recommended to him is that he walk with BFR 5 days a week. He's going to use lower extremity cuffs. He'll be at 60% limb occlusion pressure, and he'll just go for a walk at a pretty good heart rate reserve of 40%. And if you're not sure how to do heart rate reserve, you can check out a previous video of mine on my YouTube channel for how to establish your heart rate reserve. But that'll tell you the intensity. Duration is going to be 20 minutes, so no more than 20 minutes with the cuffs on. And then he's going to do twice per week upper body resistance. And I would recommend, if he's going to do strength training, that we do multi-joint exercises, like compound exercises, and we're going to do push and pull on the same day. So I haven't written out his program. He wants to do some training with me first. He'll do, I'm going to guess he's probably going to do a couple weeks with me, and then he'll decide to get his own cuffs if he likes it. So I'm going to probably program him where he's doing a modified press. So we'll do like a modified push-up, elevated up like on a counter, and we'll do some sort of pulling multi-joint, like a row. And so that'll be 2 exercises. And then I'll probably do something simple like like a shoulder to overhead, okay, pressing front of the shoulder to overhead. And I would need probably one more pull. And so maybe we'll do probably do some bent over rows. So that'll be my programming tomorrow when he comes back in. And then give him about 4 days off, hopefully, and then we'll do it again. So we'll look at that twice a week resistance training, preferably on days he's not playing tennis. But if he's playing tennis 6 days a week, it's almost impossible not to be doing it on a training day, on a tennis day. So yeah, so any questions about what I would recommend? I don't know if I can blow that up at all. So aerobic capacity 4 to 5 times per week. And we're going to do twice a week, 2 push, 2 pull, and we're going to do multi-joint, still the same 40, 30, 15, 15, 15. And I'll start off, because it is our first 2 weeks together, we will do low pressures and low weights. Let him get used to these exercises before, so I don't overcook him. Lewis asks, I've been experiencing numbness in the arms, both from elbow to fingertips. Is it possible for BFR to cause this? I mean, it's possible. As long as you're wearing the cuffs up high, as high up on the arm as possible, the likelihood that it's coming from BFR would be limited. I don't know. I'd have to take a look at of everything. If you're having it on both sides, we have to take a look at your neck and see if there's anything going on in the neck where it's coming from the spinal column. Anything else that might be doing over gripping. You could be getting it bilateral. It's not common, but getting it from over gripping or over supinating with both arms at the same time. It's a possibility, but I wouldn't expect that from BFR if you're using it all the way up to the top and you're using the pressures that we recommend, no more than 50% LOP. All right, any questions about my case study here? He's about 60 years old, tennis player, wanting to implement BFR. All right, awesome. Well, no other questions. I will see you guys next week. Have a great new year. And thank you so much for your support this year and looking forward to 2022. Thanks so much. Bye for now.